Veins of lower limb can be grouped as superficial, deep, and perforators. Superficial veins. They are present in the superficial fascia. They are thick-walled. They contain numerous valves to prevent backflow of blood. Most of the blood in the superficial veins is drained into the deep veins through the perforating veins. It includes great and small saphenous veins. Deep veins. These are the veins which are present deep to the deep fascia. These veins accompany the arteries and are surrounded by powerful muscles. The surrounding muscles help in venous return. It contains more valves when compared to superficial veins. Medial and lateral plantar, dorsalis pedis, anterior and posterior tibial, peroneal, popliteal, and femoral veins are the deep veins of the lower limb. Perforator veins. They connect the superficial veins to the deep veins. They perforate the deep fascia, hence named as perforator veins. They contain valves which controls the flow of blood from superficial vein to deeper veins. It prevents backflow of blood from deep to superficial veins. There are about 5 perforators in relation to great saphenous vein and 1 perforator along the small saphenous vein. Great saphenous vein. It is also known as long saphenous vein. Formation. Dorsal digital veins unite to form 4 dorsal metatarsal veins. These metatarsal veins forms an arch over the proximal part of metatarsal bones. This is known as dorsal venous arch. Great saphenous vein is formed by the union of medial end of dorsal venous arch with the medial margin vein of great toe. Course. Great saphenous vein passes in front of the medial malleolus, crosses the lower 1/3 of the medial surface of tibia, reaches the back of knee. In thigh, it inclines forwards to reach the saphenous opening, where it pierces the cribriform fascia. Termination. Great saphenous vein drains into the femoral vein after piercing the cribriform fascia. Valves. Great saphenous vein contains about 10 to 15 valves. These valves prevent backflow of blood. One valve is always present at saphenofemoral junction. Perforators. Great saphenous vein is connected to deep veins through perforator veins. There are 3 medial perforators near the ankle. Upper perforator lies at the junction of middle and lower third of leg. Middle perforator lies above the medial malleolus. Lower perforator lies posterior-inferior to the medial malleolus. One perforator just below the knee. One perforator in the adductor canal. Tributaries. Medial marginal vein is formative tributary. In the leg, posterior arch vein. It begins from a series of small venous arches which connect the medial ankle perforators. It runs upwards and joins the great saphenous vein below the knee. Anterior vein of leg. In the thigh, anterolateral cutaneous vein of thigh drains the front part of the thigh. Posteromedial cutaneous vein of thigh or accessory saphenous vein drains the posteromedial side of thigh. Before piercing the cribriform fascia, the great saphenous vein receives superficial epigastric, superficial circumflex iliac, superficial external pudendal. Just before termination, deep external pudendal vein. Small or short saphenous vein. Small saphenous vein drains the lateral border of foot, heel and the back of leg. Formation. It is formed by the union of lateral and of dorsal venous arch with the lateral marginal vein. Course. Small saphenous vein enters the back of leg by passing behind the lateral malleolus. It ascends lateral to the tendocalcaneus, passes in the middle of the calf and reaches lower part of popliteal fossa, where it pierces the deep fascia. It is accompanied by sural nerve. A lateral perforator at the junction of middle and lower thirds of leg connects the small saphenous vein with peroneal vein. Termination. Small saphenous vein ends by draining into popliteal vein.